A case presentation about interdisciplinary treatment for orthodontic-prosthodontic patient. In this case, a 27-year-old woman presented in the clinic with aesthetic complaints regarding her smile and anterior teeth. She had a diastema between her maxillary central incisors, had cone-shaped maxillary lateral incisors, and had stained teeth. Figure 1 shows the patient's initial facial views, and Figure 2 shows the patient's initial facial views smiling. In this figure, Figure 3, it shows the initial intraoral views of the patient. As you can see, the spaces on the mesial and distal aspects of the maxillary right and left lateral incisors are so small, which is not enough for veneer placement. Also, there is a diastema between the maxillary central incisors and moderate crowding of mandibular incisors. These are the initial lateral cephalometric and panoramic radiographs of the patient. The lateral cephalometric radiograph shows that the patient has dental and skeletal class 1, deep bite with severe short face, and vertical position of the upper incisors with very steep anterior guidance. The panoramic radiograph shows the conoid laterals and moderate crowding of mandibular incisors. This shows the initial digital smile design of the patient. It shows how the maxillary lateral incisors would look like with the veneers. The treatment plan for the patient is an interdisciplinary approach involving orthodontics, cosmetics, and prosthodontics. Orthodontics aims on opening the bite, increasing the vertical dimension, reducing the overbite of the anterior teeth, solving the mandibular anterior crowding, and creating the right symmetrical space for the reconstruction of the maxillary lateral incisors. Cosmetics, specifically bleaching, aims on brightening the color of the teeth of the patient before dental restoration. And prosthodontics, which are ceramic veneers, aims on restoring the cone-shaped lateral incisors.
Collaboration. So, specialist. Orthodontist corrects the open bite by leveling the lower speak curve by using anterior bite stop. So, orthodontists are dentists that aims on the alignment of your teeth. So, cosmetic dentist, bleaching before dental restoration in order to whiten the teeth before it receives restoration. So, prosthodontist, so they are dentists that prepares the tooth for the fabrication of ceramic veneers to restore the cone-shaped lateral incisors. Procedures and techniques. Orthodontic treatment. So, the Alexander discipline, so basically it is a straight wire technique, so it is being utilized. 2-bite turbo from Ormco was applied on the lingual side of the maxillary incisors, followed by an application of some composite to increase the amount of volume for a right contact with the mandibular incisors. So in this picture, the palatal side of the upper incisor with 2-bite turbo can be seen. So this anterior bite plane, so it gains the space for the lower banding. So rectangular lower arch together with AD brackets allowed leveling of the originally deep curve SPI. So one of the goals was to reduce the retro inclination of the upper and the lower incisors to gain more space in the arches for upper lateral incisors and for lower crowding solution. So this increase in the anterior torque would give a better support to the lips. By evaluating the goals, it would be well accepted from a functional point of view in relation to the reduction of the overbite and the steepness of the anterior guide, still respecting the functional area of the patient. So the orthodontic treatment only lasted for 11 months, and immediate retention with fixed splint from K9 to K9 was being applied, especially on the maxillary and the mandibular arches. Procedures and techniques of bleaching. So basically there are 2 steps before any dental restoration. So first step was a chair side starter application by the use of 40% hydrogen peroxide gel. The second step was a take-home whitening protocol, so basically 10% carbamide peroxide for only 2 weeks. Procedures and techniques of ceramic veneers. So there are two types of preparation, clinical and the laboratory aspect. So we must tackle about the clinical preparation first. So the silicon index was very useful to perform a minimally invasive preparation. So you should only remove enamel for only about zero point 0.2 to 0.4 millimeters thickness, and it should be rounded, especially in the cervical and buccal areas. So the purpose of the rounded tooth preparations is to reduce stress in the restoration. So the sharp line angles will lead to stress concentration at those areas that will cause fracture on the tooth. So this is what I've mentioned. So this is the silicon index. So the use of silicon index will help you ensure excellent control over many aspects during treatment, or especially in making tooth preparation for veneers. Procedures and techniques in ceramic veneers in the laboratory technique. So the original transparent impression used for the mock-up was also used in a temporary restoration that was molded with acrylic resin. So refined and fixed with this sequence. So phosphoric 37.5% etching for 30 seconds in 2 or 3 small areas. Cleaning with water for 60 seconds. Enamel adhesive application and light curing for 60 seconds. Feldspathic ceramic was being made on refractory abutment. Teeth built to the natural dimension, obtaining the shape from a palatal silicon index of the wax-up. So the realization of the contour profile is simplified by the use of the reference point mark with pencil. So enamel ridge and transition angle lines are being decreased or reduced or sharpened by using a diamond burr. So vertical and horizontal surface texture created with the help of surface colored powders available in a color of gold or silver. This figure, so it is the surface texture of a veneer. Surface texture polishing phase is a combination of mechanic technique with diamond silicon polishers and glazing by oven. So mechanically finish polishing by using pumice powder or diamond paste because they have the ability to smoothen out surfaces, producing highly brilliant surfaces. This figure, you can see the surface finishing of veneers by the use of the pumice powder or diamond paste. Cleaning with pumice and water, etching with 37% phosphoric acid for 20 seconds. Adjacent teeth were protected with Teflon tape. Cleaning with water for 60 seconds. Primer was being applied and adhesive, especially the fourth generation, the Optiband, on the teeth and only adhesive on the veneers already prepared with silicane. Apply the light curing composite previously warmed at 55 degrees Celsius on the restoration. The veneer must be put on the tooth with a slight ongoing pressure in order to remove all the excesses with brush, scaler, floss, and plastic strip. After the excesses were removed, proceed with the light curing for 5 minutes from every direction. Then you must apply the primer and adhesive on the teeth and only adhesive on the veneers, specially prepared with silane. Apply light curing composite, previously warmed at 55 degrees Celsius on the restoration. Lastly, straight blade chisel can be used to refine, especially the finishing strips, floss, and rubber polishers to obtain brilliant surfaces.
Results and outcomes. The treatment plan achieved the right distribution of spaces for upper lateral incisors, significant correction of the inclination of the incisors with an important reduction of overbite and better lip support, upper lateral restorations with ceramic feldspathic veneers obtaining a good integration with natural teeth, satisfying patient complaint. Significant correction of the inclination of the incisors from 2 degrees to 11 degrees and from 157 degrees to 137 degrees inter-incisal angle. Reduction of the overbite. So as you can see before and after the treatment, this was also shown in the cephalometric analysis. the changing of the interincisal angle and the NA Steiner's analysis angle. No changes of vertical dimension was observed. According to the cephalometric analysis, Tweed's analysis, the FMA remained 15 degrees from the initial until finished work of the prosthodontist and orthodontic. Alignment of the lower incisors. Alignment of the lower incisors. So in figure 3, we can see that the initial intraoral view that there is anterior mandibular crowding with twist and overlaps with the mandibular anterior incisors. After prosthodontic and orthodontic intervention, in the final intraoral view with the veneers, there is no more anterior crowding and the problem has been eliminated. And lastly, the significant reduction of inclination and overbite has led to better lip support with no loss of vertical dimension.
The results and outcomes of the treatment show the effectiveness of interdisciplinary approach. It shows how the orthodontic treatment corrected the overbite of the patient, solved the mandibular anterior crowding, and closed out the space in between the maxillary central incisors to accommodate veneer placement for the cone-shaped lateral incisors. After orthodontics, bleaching helped whiten the stained teeth of the patient. After bleaching, ceramic veneers help in correcting the form or shape of the maxillary lateral incisors, which greatly improved and solved patient's aesthetic complaint. According to Al-Ghamdi, patients with complex dental conditions can only be successfully and effectively treated by interdisciplinary approach. In such cases, it is important to properly analyze and know which specialties must be applied or used to solve the problem. Through application of interdisciplinary dentistry, a lot of complex cases will be successfully treated, which results to enhance patient outcomes and satisfaction. In conclusion, interdisciplinary approach is an effective technique in treating complex dental cases. It combines the necessary specialties to address the problems of the case. It involves collaboration between various dental specialists to help create a comprehensive and effective treatment plan for the patient. With the application of interdisciplinary dentistry, patient care is greatly improved. The treatment outcomes of the patients are much better. A lot of complex cases are and will be successfully treated or solved. This helps in enhancing patient outcomes and satisfaction and in improving the practice of dentistry.